Mr. Speaker, may I move for a motion on the need to check the incidence of drug abuse among the youth? This motion notes that Nigeria has a young and vibrant youth population, over 60% of whom are between the ages of 18 and 35. And for the country to attain growth, the youth must be kept healthy and sound. This motion also notes that drug abuse not only affects the mental health of the abuser, such as occasioning depression, anxiety, bipolar disorder, and madness, but also makes the person prone to so many antisocial behaviors. This motion recalls a publication in September 2015 edition of the European Scientific Journal, Volume 8, that more Nigerian youth are becoming drug dependent, while Nigeria is gradually transiting from the status of a drug-consuming nation to that of a drug-producing one. Concerned that this destructive and damaging trend is becoming prevalent both among the wealthy, middle class, and the poor cadres of the society. Worried about the rate at which illicit drug consumption is spreading in not only the institutions of learning, but also to other facets of the society, such as motor parks, recreational centers, civic centers, apprentice workshops, etc. Also worried that the statistical data of the National Drugs Law Enforcement Agency, NDLA, from 2008 to 2014 reveals that drug abuse and drug-related offenses are on the increase every year, as a total of 56,089 people have been arrested for drug-related offenses during the period under review. Cognizant that if nothing is done to nip this ugly trend in the bud, it will cut into the very existence of this nation. This motion seeks that the House resolve to urge the NDLA to intensify the campaign against drug abuse and to step up efforts to arrest and prosecute drug offenders. 2, to urge the NDLA to maintain a presence in tertiary institutions in Nigeria to ensure drug-free campuses. 3, to further urge the Federal Ministry of Education to provide guidance and counselors in secondary schools trained by the NDLA to educate students on the dangers of drug consumption. And 4, equally urge the NDLA to establish more drug rehabilitation centers in the country for rehabilitation of drug addicts. I so move, Mr. Speaker.
Agbedi Yejim Frederick is my name. I represent Sagbama Ikirima Federal Constituency. I'm an Izon man from Bayelsa State. Mr. Speaker, honorable colleagues, I rise to second the motion ably moved and defended. I so second.
This sector. Honorable Jagaba, Adam Jagaba is my name, member representing Kechiaka Galko Federal Constituency, Mr. Speaker. Thank you. This issue of drug is a very, very serious matter in this country. A lot of us, particularly those in authority, we ignore that sector. And that is the key thing that is causing a lot of problems in this country, Mr. Speaker. Mr. Speaker, I'm interested you to know that the thing has degenerated so low that drugs are being sold in our secondary schools. So low to the point that even our primary schools, you go, drugs are being sold there. Now, Mr. Speaker, why do we have these problems, unabated problem? The key thing, for the past over 16 years, NDLA has been abandoned. The Act provides, Mr. Speaker, that they should man all our borders. They should be everywhere in every local government. They should be in all ports. But right now, as I'm talking to you, Mr. Speaker, they don't have enough manpower. They don't have enough staff to go around these places. Lack of training. They don't have equipment. Even sniffer dogs they don't have. It has been so neglected to the point that if we don't, Mr. Speaker, stand up and urge the federal government to do something urgently, this country, Mr. Speaker, may be forgotten because of this. It may interest you to know, Mr. Speaker, honorable colleagues, that all the crises we have, being in Boko Haram, being in Niger Delta, being in Odudua people's contest, being it people that are seeking for Biafra, being in robbery, kidnapping, they are all drug-associated problems. So, Mr. Speaker, right now, there is one terrible drug, Mr. Speaker, that is in this country now, that I want to tell us. We have one cannabis that is being, produced in Ghana. It's so strong, just a little bit lower than cocaine. And they are bringing these things from Ghana to Nigeria. And it's a terrible drug. Apart from that, we have metacafin. It's so terrible, more terrible than even cocaine itself. We have many laboratories in Nigeria, and NDLF are arresting these people, sealing all these places. Mr. Speaker, it's a very serious problem. Now, having said this, Mr. Speaker, I want, with the kind permission of this House and the leave of the Speaker, add a prayer that we urge the federal government to recruit more staff and train them in order to man our borders, take care of these local governments, so that they will have enough staff to go around to help solve this problem, Mr. Speaker. Thank you very much.
Near Sanibala, representing Kunchi Sanya constituency, and I'm from Kano State. I rise to second the amendment as made by Honorable Jagaba. I so second.
Except to say that my only concern, and I think we should look at how to address that issue, so that this motion, wonderful motion, is not an exercise in futility. The amendment we just took talked about training and manpower. And the last prayer of the motion talks about, or urges that we establish more rehabilitation centers. Those two prayers require finances. And I think this would have been the perfect time, just before the budget is passed, if it hasn't been done already, to liaise with the committees directly in charge and the appropriation and make sure that is put in the budget. We cannot do it by way of motion. And if it's not, then if it's too late, then we have to look for some, at some point, environment or whatever it is, but we have to look for some legal mechanism to accomplish or to make sure what she has set forth to do, that prayer is actually giving teeth. We need to appropriate money for the rehabilitation centers, because without that they can't do the motion will be an exercise in futility. So I totally support this motion. It's a very good motion. Thank you, Mr. Speaker.
Mr. Speaker, 1/3 of the cases we have for HIV/AIDS have been linked to sharing of needles by drug injection abuse. There's also a frightening dimension, Mr. Speaker, in the drug abuse. I'm from Kano, Mr. Speaker, and Kano has one of the highest cases of drug abuses in the country. And that is the use of codeine. Codeine, Mr. Speaker. And it comes in different forms. There's Benylin with codeine, so many drugs. It's actually a drug, a cough syrup, Mr. Speaker. So many married women are using it. So many children are using it. And it is very, very scary, Mr. Speaker. This motion, it is a very important motion. Thank you very much, Mr. Speaker, for giving me the opportunity to speak.
Motions refer to the Committee on Drugs and Narcotics for the legislative